طيب بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على رسول الله أجمعين وآله وصحبه أجمعين. احنا سعيدين يكون معنا دكتور رايد اليوم. Thank you very much, Dr. Raid, for giving us uh, some of your valuable time and to contribute in the academic leadership and management course. And I think your contribution will add a lot to this course, given that it's the last course for this batch 5, Master of Health Profession Education, Faculty of Medicine, University of Khartoum. So, on behalf of my colleagues, the faculty of the EDC, the facilitators, instructors, and the EDC director, I would like to extend my greatest appreciation for you for joining us today. And we are very eager to have a wonderful session with you and my colleagues from the candidates as well. So allow me to introduce you to my colleague. We are very pleased to have Dr. Raid Albar with us today. Dr. Raid is a physician, a researcher, and educator. He holds a bachelor's degree of medicine and surgery from Al Faisal University, a master of medical education from University of Dundee, and a PhD in health profession education from McGraw-Hill, Massachusetts General Hospital Institution of Health Profession. He's also a faculty of Al Faisal University and an academic and life mentor with a mission to help learners to achieve their professional and personal goals. Dr. Raid, as well as a certified body language and personality trainer with a keen interest in the science of nonverbal communication, behavioral and educational psychology in the health profession arena. He's also a certified conflict coach and a workplace mediator in health care. He aspires to create an interprofessional education ecosystem and a focus of developing emotionally intelligent teams. Dr. Wright, without any further ado, I would like to thank you again, and we are very eager and pleased to have you with us to your session. Welcome, Dr.
Thank you very much, Dr. Cham. I'm really honored to be here, part of this community. And yeah, let's نقول بسم الله. بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. السلام عليكم جميعا. This topic is difficult to talk about. Not an easy thing to handle, and whether it's in healthcare, whether in or in our personal life. When we hear the word conflict, we just put negative connotation on it. That's why conflict, we always see it as a storm. At least that's the term that I like to use here. It's kind of, I'm kind of pitching of being problematic here with conflict. And again, leadership is not an easy position to hold, because leaders always face conflicts with their teammates, with other leaders, with other stakeholders, and with patients and their families if they're involved in clinical care. Why do we have conflict? احنا now in healthcare setting طبعا any healthcare system always requires health professionals to work together. Physicians, nurses, pharmacists, lab specialists, physiotherapists, occupational therapists, and so on. They always need to work in team and collaborate to improve patient experience and outcomes. That's why effective teamwork is important, and it's becoming more difficult nowadays because of the complexity of healthcare the system, and it is going to increase in complexity as as we have more technological advancement in healthcare system. So that's why effective teamwork is important. And patient care always requires and relies on effective communication, clear understanding of roles and responsibilities of us as healthcare providers and leaders. The ultimate goal is to enhance patient outcomes, safety, satisfaction, and thereby underscore the importance of working in teams. Nowadays, healthcare, we don't work as, oh, not as I said, that we don't work in silos. We're always going to work as teams, whether interprofessionally or intraprofessionally, which makes it even more difficult. And this is why handling conflict is always going to be part of our our healthcare system, whether we like it or not. Some statistics here. Around 43% of physicians, or let's say healthcare providers, experience conflicts with nurses and intensivists about post-operative cause of patient care issue. 41% of conflict stories had potential consequences for patient care issue. 24% of healthcare professionals reported that they would leave or they think about leaving their jobs because of conflict. And that adds a more stress on the already shortage that we have in healthcare. So also medical students, based on their reflection, they're saying that conflict among healthcare professionals are most of the conflict in healthcare profession. The conflicts are handled poorly. There are unclear expectations. There are hostile communication. There are rigid hierarchies. There are power imbalances, mistrust among the healthcare team. The residents command stress, adding more, more pressure on this. It becomes the whole environment becomes psychologically unsafe because of conflict. This is the roadmap that I'm going to talk about throughout this 1 hour, or inshallah less than 1 hour. The first part is going to be the whole anatomy of conflict. And the second part is what I call the pork and the roadmaps, because this is why we give a negative connotation on conflict. It is kind of a pork that we need to deal with. Then give you some toolkit as leaders and some advices or recommendations for leadership and culture or safety culture in the healthcare environment. So let's start with part one, the anatomy of conflict. And the whole objective of this is to explain the nature or characteristics of conflict and the source of conflict in health profession, education environment, and also healthcare, since we're always going to be involved in clinical setting. There is no universal definition of conflict, but it always has a negative connotation. But one of the definitions that is there in the literature is a struggle or context between healthcare providers or professionals with opposing needs, opposing ideas, opposing values, opposing goals, opposing clinical background, opposing clinical different clinical trainings. All of these could cause struggle and to reach an agreement about whatever, whether healthcare. If we're talking about academic, just purely academic settings, I think we all know what conflict looks like. The question is, why does it matter? Why does this whole topic matter? Is it a trivial thing? No. Conflict where it's not avoidable. Whether we like it or not, we're always going to face conflict. It's part of our life. And it is even more, it becomes even more difficult because the healthcare system is very sensitive. And also it's a fast-paced environment and high-pressure environment. Workload is heavy. It's like conflict is always going to be there. So it is a crucial aspect of collaborative practice. The idea is that as long as we work on team, as long as we need to communicate, conflict is always going to be there. So why don't we use conflict in our advantage? That's the real question in the whole topic of conflict. Let's talk about some triggers or sources of conflict. Now, in the literature, they are divided into two types: systemic sources and relational sources. Now, the systemic sources, they are related definitely to the hierarchy. So we have a very rigid hierarchical system in healthcare. And we know this purely. The power imbalances because of the hierarchy and because of the different professions. We always see that physicians are at the top of the hierarchy and nurses are kind of below them and other professions probably below them. So this hierarchy and it creates power differentials. Who has the most responsibility of patient care? Who has the utmost decision? Who is the decision maker in healthcare? Although everyone has their own role, it always also would create kind of disagreement because of this kind of ego egotistic differences between the professions that okay, I'm a doctor, I'm a nurse, I am. That always create kind of friction between healthcare team and ineffective leadership. Again, when we don't have supportive leadership, that could be that's why I call it a systemic sources. Because leadership is part of the system more than the individuals in the team. Again, the time pressure and the workload pressure, we always know that healthcare environment has these two elements that people, I would say that we all know that people hate this kind of the high workload and time that they don't even find time for themselves to reflect. And it becomes a very difficult learning environment. For the personal factor, the personal dynamic kind of thing. Communication failures. There are always going to be misunderstandings between between professions because of different background, between people because people are complex. They have different values and different perspectives. Using harsh language is kind of also personal. Personality clashes. Again, I don't like that person because sometimes there's no because I just don't like that person because it's conflict. The invisible walls. That's what an interesting term that the literature is saying. Invisible walls because of differences in professional identities. Physicians have different kind of identity formation than nurses, than lab specialists, than physiotherapists, and so on. These are kind of an invisible walls create silent sort of conflict, which also create different because of different priorities, so to speak. Types of conflict. There are so many types, at least and these from the literature, they categorize into these three kind of types. Interprofessional versus intraprofessional. So let's say between nurses among themselves, or between physicians among themselves, or between physicians and nurses. They have different kind of types of conflict. Now, according to the lecture, the most common conflict in intra-professional healthcare setting is personal relationship. But there is no reason behind it, or I still don't know what is the reason behind it, but there is interpersonal or relationship constraints in between between the healthcare providers in the same profession. You can see this let's say between a consultant and a resident, or a resident and medical student, or an intern. That's the relationship becomes constrained for some reason. Maybe the hierarchy goes into or part of it here. For interprofessional, usually the most common causes, at least, they have professional disagreement about patient care, about treatment, about whatever. That's let's say between physicians and nurses. That's most common two professions there. That's one characteristic, or let's say one type of conflict. Another category or another type of conflict is task versus relationship. Task means that it's work content related, process related, and yeah, that's basically just we disagree on, let's say, treatment plan. But in relationship, this is where the clashes with personalities and perspectives, sometimes with differences in values and priorities, start to kick in here. Task versus relationship. Now, one thing is important to note here is that a content, or let's say a task uh, related conflict, can quickly escalate into relational ones because of, especially if if it's handled poorly. But that's common. So sometimes the whole conflict, it becomes a mix between the relationship and that. We don't the whole it becomes a lengthy argument that you don't know where what's the problem, where the start of the conflict, where did it start? That's an issue. Now, probably another issue, that's a new thing that I discovered also in my research, that over versus covert conflict. There are conflicts that are very openly expressed. We know that this is a conflict. We can talk when we talk about it and we spread rumors about it. It's like very clear about it. But there are conflicts that are silent, that either they are ignored or they're not realized. And it just causes clinical disconnection. Part of these silent conflicts are because we as healthcare providers, we really care about the professional relationship that we have with each other. The reason for this, because it is a stressful environment. So we care about, like, we want to work in harmony. So when we don't agree and we don't like something, we just let it slide. It becomes a silent sort of conflict, but we hold it in our mind and our hearts, and it starts to, let's say, to seep out from certain kind of behaviors that we don't even realize is that we're acting this way because of the conflict. So also this is like a dangerous thing, that patient care is affected because we have a silent conflict that we don't want to address because we want to maintain the relationship. It becomes very complex. That's the idea. I don't know sometimes what to say about this. It's easier to deal with an open conflict, that because we know what's the problem and we express it openly, as opposed to the silent conflict when we deal with floor politics just to maintain the atmosphere. Other dimensions of conflict, the ethical and moral dilemma. These, now, what the research is saying that sometimes conflict arises from these ethical dimensions of patient care, where what appears to be a communication issue is just often rooted in a moral dilemma, which highlights, the concept of moral distress, a very common term in the literature, especially among moral distress is very important among nurses. I mean, when there's a conflict between a nurse and a physician, because they don't feel that they're taken seriously by the physician in high stakes situation, especially when it is in an ethical or moral dilemma. So that's also another kind of dimension of conflict. Another dimension of conflict is the professional identity, values, and social representation of the profession. Now, this part of this dimension examines how a person's sense of self, which is derived from the profession itself, can trigger conflict. So a strong identification with one's own professional group, it can create like an us versus them. We are physicians versus nurses. We are, let's say, consultants against residents, because we are at the top of the hierarchy. This creates a mentality and of different professional values, lead to tension and clashes about, now you name it, let's put it in healthcare about diagnosis and treatment strategy because the mentality هذا اللي انا دكتور versus انا اللي فاهم وانتم ما اخذتوا we didn't take the training that I took. هذه مشكله. So that, what are the consequences? Three categories كمان في consequences هذه. واحدة على patient care. One on the professionals' well-being themselves, and then it becomes on at the team and organization level. For example, in patient, طبعا the treatment, the safety, the overall quality of patient care get messed up. Professionals' well-being, again, the stress, the anxiety, the job dissatisfaction, the thinking about leaving the whole profession just because of conflict. Burnout. I think burnout is something that now people leaving the profession because of burnout. Even if they don't think about it because of conflict, burnout, conflict leads to burnout, which leads to consequences that يعني ما تخطر. طبعا organization and team functioning it affects the team morale, the productivity of the team, it becomes a toxic culture, and يعني the whole environment becomes psychologically unsafe because conflicts are not handled well, and because conflicts are always seen as negative. Something to think about. طيب هذا الحين the whole thing about the first part اللي هو anatomy of conflict. Let's go to the second part of conflict. We want to differentiate between now constructive and destructive behavior of conflict in the conflict cycle. Let me show you this. Now we have this model in front of you. It shows that, or let's say it starts with a conflict event. The conflict event could be someone is triggered, and then a conflict response will happen. That conflict response is going either to be destructive response or a constructive response. You have now on the right side you have 8 behaviors, destructive behaviors, and on the left side you have 7 constructive behaviors. And also these are subdivided into active and passive. Now, can think about that. Active destructive behavior can ruin the whole team. And passive is just when you don't do anything. You just avoid the conflict and احنا what we say انك تسلم and this and تسلم في conflict يعني. Hiding emotions is also a passive conflict. And always people say that this is a professional environment, we shouldn't express our emotions, which is, even from the psychological point of view, it is wrong. There is a proper way of expressing your emotions. But hiding emotions is always going to eat you from inside. So that's why it is destructive. And also self-criticizing, having self-doubt. And why did I do this? Why did I do that? Why did they do this? Why did they do that? Yeah. It becomes constructive when you self-criticize yourself a lot. On the left side, you see that the constructive behavior, they are also active or passive. Active, when you act now in the moment, let's talk this out. Let's hear each other. Let's do something about it. Let's solve the problem. It's us against the problem. It's not me against you. That's how it is, how it's active. Now the passive is when you want to take some time before you solve the conflict, because at the moment, in the heat of the conflict, very difficult to solve the conflict. So need some time to cool down. Now think about it. So when you think about the constructive responses, usually we think about it's easy to act constructively when it is just related to the task. We disagree about the patient plan. We disagree about diagnosis. The tension does not escalate because we know that this is a problem that we need to solve. It becomes like you, me against the problem. It's easy when it is a task related conflict. But when it becomes a personal conflict, I think we call it personal focused conflict. We focus on the personality, on someone's background, someone's values, إلى آخره. يعني becomes a negative. It leads to negative effect. Tension escalates, conflict escalates. وخرب التيم functioning, all of it. That's what this model talks about. So that's what I call it, the downward spiral. When we go into the destructive responses, the whole team is destroyed. And the upward spiral is when you become very conscious about your behaviors, about your strategies, and engaging in conflict. It becomes an upward spiral. And I always like to use this. I'm repeating this again and again and again. Me, you against the problem. It's not me against. So conflict on its own is not the problem. It's the response that the response is determines the outcome. That's another mode. The whole conflict cycle. Um, how let's I would say this. Whatever now I talked about in the model, now I'm zooming in more. What triggers conflict usually? Oh, this is now I'm working with the team. Something triggers or something is perceived as conflict. So this is typically when the whole conflict process begin with, let's say, us as professional, we perceive some a trigger, a rupture in the teamwork. This could act like a cognitive. This is like the cognitive part of conflict. So and becomes the entry point of the conflict experience when that trigger happens. And again, you can whatever you can. You say when there is a failure in communication, when there is a system problem, when there is personal different cultural background. It's like when you realize that we are not on the same page anymore. That's when you realize this is a conflict. So that's like that. The first thing that happens usually in the whole conflict experience. But after this, two things happen at the same time: your emotional response and your behavioral response. We talked about the behavioral response, which is the destructive and constructive, but these also are determined by the emotional response itself. How anxious do you feel? How self-doubt do you feel? How undermined do you feel? How angry and frustrated do you feel? This will dictate how will you respond, especially if you're not conscious enough, or you're not aware enough. And also the behaviors of others will trigger the emotional response within you, which will trigger a certain behavior that you are going to act out. And it becomes that whole thing is like two things that's happening at the same time. There's an external experience and there's an internal experience. Your behavior is the external experience and your emotions are the internal experience. And it becomes a cycle there. Something is always going to fuel the other. It's a very difficult. That's why when we are in the heat of the conflict, we need to stop and slow down. And it becomes sometimes very difficult to get out of this kind of mindset during the heat because the cycle it becomes vicious cycle. The emotion becomes behavior, and the behavior becomes even fuel more of the emotion, and so on. Very difficult experience of conflict. When this happened بعد هذا كله يعني في outcome. There was always going to be an outcome out of this. Now, the outcome, and we talked about the outcome and consequences on patient with well-being of the professionals and the organization outcome. Something extra here, people don't talk about the whole adaptation is your professional identity formation. أو أنا حتى I call this as a theme reconstructing professional identity. This is where you think about it this way. I was engaged in a conflict. This is how I acted. That there was an outcome, whatever that outcome is. Now I am going to act later on according to the results that happened earlier. Now imagine when this happens every day and every week, then over the years, it becomes part of your identity as a healthcare provider. That's why the whole your professional identity is kind of reformed in terms of dealing with conflict. Now imagine that when you go into the conflict again, into another experience of conflict, your responses are going to be kind of different, or or let's say different if you learn from the conflict, or the same in a worse format if you're not aware of it. So if you were angry and you acted out, it becomes part of you. Then you go into another conflict, become more angry because this is how you ever always dealt with conflict. So when you start learning about that, this is becomes part of you, and you don't want to be this. The whole conflict becomes part of your identity, and people always talk about you badly behind your back or in front of you. That you are very difficult to deal with. So this is how I see the whole cycle of the conflict, or the dynamic cycle of conflict, the experience of conflict. And that's why even in the research that I did, many people they were aspiring to learn about conflict management because they're not liking the person that they're becoming because of conflict. Think something to think about. Right. Let's go to part three. Leaders tool, the toolkit. I'll give you some frameworks and also how to engage in conflict, practical framework. And I always think about you as leaders, not just part of the healthcare team. You're not let's say regular healthcare provider or the regular teams, because you're leaders, you're holding positions, and you have you have a say in your organization or a team. So I'm thinking about it now from leaders' point of view. So I talk about these two, uh, let's say, what do you call it? Model, the cycle and the model and the model. So how would you first diagnose that there is a conflict? Starting with you as a leader. That's one thing that I'm gonna probably I want to start with, and I'll continue until the end of the session. The story always starts with you as leader. So I'm gonna talk to you as a leader, as a person. I'm not talking about having a conflict that you need to mediate between your colleagues، or يعني تحل مشكلة بين الزملاء. You are in the conflict. You are a leader. Think about what triggers you. Think about, and now I think since I talked about 15 different behaviors, constructive and constructive and destructive, 7 constructive and 8 destructive, and hot buttons or triggers. You can call it either way. Pick the top 3 hot buttons, something that triggers you as a leader. Out of these 9 in front of you, these are not the only, but you can, if you have something that you know for sure and not on the list, you can write it down. 3 hot buttons, and think about 3 constructive behaviors that you think you are proud of from the list on the left side, and think about 3 destructive behaviors that you wish that you don't act it out. It just happens because conflict is always going to be emotional. I'll give you 2 minutes to think about this. And why this matters, and conflict is not something just to talk about. Maybe it's fine to talk about, or good to talk about in conferences and courses, but conflict is an experience, and it shapes a lot of how we view the world. When we don't, whether we handle it well or we don't handle it well, it's an experience that is very emotionally charged, and it takes effort to solve the conflict. And I always say that conflict, though engaging in conflict is not pleasant, but if you engage in it uh, properly, constructively, it becomes a risk worth taking because the reward is going to be higher. At least this is how I see it. So that because conflict is an emotionally charged experience, at least important part of it is self-management. Again, as healthcare providers or as leaders, you think about now you are triggered. What are you going to do when you're triggered? Lash out or you cool down. How you cool down, and you need to be aware of your physical responses and the negative emotions that you are experiencing. Now, sometimes it is very heated argument. You need here where I call it that you need to slow down. Slow down معناته let's take a time of and discuss this tomorrow, or let's discuss this in an hour, let's discuss this in 15 minutes. It's too heated to solve anything now. So if you don't know how to cool down, you need to slow down, get out of the environment. After that, you cool down, you reflect on what happened, then you start engaging now with the conflict or with the person that you have a conflict with. Probably not, you don't engage with conflict, engage with the person, your conflict partner. The question is, how do I approach? I created these 4 steps of engagement. Now, this is what I call self-mediation. You're solving your own conflict with your team or with your conflict partner. I don't talk here about you going in and solving the problem between your team members. Because that's also another set of skills. And my goal here is first to develop your capacity as a healthcare professional and as a leader when you have your own conflict with the team. بعدين you mediate. If you master this skill to begin with, it becomes now you become more skilled بعدين later on, or it's easier for you to learn how to mediate between team members, how to approach. Now, any conflict will not be resolved without initiating contact, without reaching out. So I call this that be the bigger man and go you initiate the reach out if you want to actually really solve this conflict. Especially when you think about that this conflict is not me against you, it's me, you against the problem. So let's do this now. This is how you reach out. The most discomfortable step is to reach out. I know that many people in conflict they say, I don't want to see his face. عادي, it happens. This is a normal human behavior when when we don't like someone because of the conflict. So here is where the risk. It's risky. You might get lashed out from your partner, but it is worth it. And the higher the risk, the higher the reward. Second step here is called perspective taking and listening for understanding. Now let's add up. Then I would say the second or third step. They are kind of مع بعض. You can start with one of them. Either you want to listen first, or you express yourself and then listen. Both work. And I feel like because you are the better person, you want to understand from their point of view. So give them the mic, let them talk, let them express themselves freely. And then I repeat what they're saying and let them give you the approval that, okay, this is what I meant. Because they want to be listened to since you started the initiation and خلاص كمل المعروف. I'm gonna listen until the end. I'm not gonna listen to reply, I'm gonna listen to understand. Then the next step, okay, you said your part. Now let me say my part. You express yourself with the emotions, the thoughts, the interest in solving the issue. Do the whole thing. What happens usually is that when we listen first and we express like pure intention, compassionate intention to listen, usually even if that person was heated and they hate us like to the point, they are going to calm down and they're gonna start liking you for a bit at least. Then when you start expressing yourself, they are going to listen to you, especially if you are respectful in your approach when you express your thoughts and the emotions. And when I say you express your emotions, I don't say that you start throwing glasses on them and you start shouting. That's not how you express emotions. You can say that I am angry at what happened, but you say it respectfully. Don't say you don't lash out. That's part of expressing. That's that productive expression of emotion. طيب سمعت لك وسمعت لي. You listen to me, I listen to you. It becomes now easier to find find the solution. Even you're going to problem solve and you start finding creative solutions for the problem because both sides listen to each other. And it's going to happen this way if it's command constructive engagement. What are your solutions? I have A, B, and C. Okay, and I have C, D, and E. Okay, now what are the upsides of these three, and what are or let's say of the upsides of these six solutions, and what are the downsides of these six solutions? Okay, now let's compare and see which one fits the fit to be the ideal solution. It becomes easier. Now this is first part is reaching out is the most difficult part. The second part is now listening and expressing yourself. This is going to be dynamic. It can take it takes a while. Listen, go. It becomes a bouncing ball between you two. So once you do that, everyone listen to each other respectfully. It becomes very easy to come up with a solution. And it is again, the whole negative experience of conflict is going to be something that you are proud of, that you reached out and it leads actually to a solution. How about a case? I like to add this is usually my favorite part. Since we're educators at the same time healthcare providers, we can take it from both sides. I call this the title of the case, teaching moment versus the empty bed. I would like you to read this. I would like to give you some time. If I have some time يعني, to finish the presentation. And this is important for you to reflect. The case is on the left side, and then read the questions on the right side. Give you 5 minutes. Go Bismillah. طيب, maybe you can take a screenshot of the case بس أنا for you to reflect at the later on after we finish. Just wanted to hold some thoughts on what you have read now in the case and the question on the right. Now, last part, leadership and culture. What is your role as a leader? How are you going to integrate this in your institution culture? Difficult? Necessary? Yes. Difficult? Yes. The complexity of healthcare system is enormous. That's why it is always going to be difficult. So now we're working now in an arena where the conflict happens. What are the things that there are so many things to navigate: the hierarchy, the role, the the whole systemic factor, the high workload, the shortage that we're facing. It's a fast care environment, resource constraint. Your data, how are you going to handle that? One thing to take into account. Also, I don't think a lot of the literature talks about this, which are the navigating the personal stressor. Now, people have been saying that this my personal life, whatever challenges that I have in my personal life, it comes with me in the healthcare environment. And تخيل انه it's already a stressful environment كمان adds another emotional burden عليا. Difficult. So work life, this is what the work life start to spill over. Uh, do we need to handle this? Or we shouldn't care? It is a professional environment. Leave your emotional baggage at the door when you get in. When you leave, take them with you. We don't want to see that. Is that feasible? Is that possible? I don't think so. Even if you think you are the most emotionally stable person, people are different. So think something to think about. Another thing to think about. There are always going to be assumptions. That's why not communicating is going to blow up that assumption. The implicit assumptions that we have about other people is always going to be there. That's why open and honest communication is important. So we try to minimize these assumptions. As leaders, how can you deal with these assumptions that people are always going to have in order not to minimize conflict, but in order to deal with conflict constructively, and in order to flip the coin of negative connotation to seeing conflict as a learning opportunity. There's a conflict. What can I learn from it? I think this is important to reflect on as leaders. Uh, so leaders, this is what I said. It becomes, this is the complexity of our job as leaders. That we don't want now just to build the skills of individual healthcare provider. We need to deal with the system. And the system is encouraging certain behaviors, kind of certain mindset and certain emotions, and this will come and reinforce the whole system. So we need to have this approach. This is what I call the approach. At least this is my own point of view. And creating a conflict resolution ecosystem. We need to do it simultaneously, top down or bottom up. We need definitely to build the skills of individual teams and team members. هذا لازم. We need to do this. Develop their emotional intelligence, conflict intelligence, how to deal with communication skills, difficult conversation. This is important. This is the bottom up approach. The top down approach need to work on this. صعب, difficult, وأحيانا there are so many layers of leaders in the system. بس هذا part of the solution. We need to create like أول شيء us versus them هذا difficult to handle. بس يعني we need to deal with this عشان to break down the what do you call it, the tribalism. So we need to create shared identity, establishing psychological safety of the team and for the team. If you want them to be open in communication and honest, lots of psychological safety. One of the most important part. This part I don't think it's very difficult, بس أنا think إنه استك نحن humans أحيانا difficult أساسا to deal with ourselves. This is important. Systemic solutions الحين يعني systemic solutions where uh, يعني reducing the ambiguity لازم يكون everyone knows their own roles and responsibilities from different hierarchies or different professions. Uh, who's who's the decision maker, and everyone should respect that. But even the decision maker should respect everyone's role. The part of the systemic solution that even one of the participants in my qualitative study said that conflict management should be part of quality assurance. And I don't know how this can be done yet. Like, this is a new thing, like a new concept that appeared. Quality, we always think about quality assurance and improving quality of the healthcare كده بس هل human skills part of the quality assurance? Conflict management part of that quality assurance? I don't think so صراحة so far. Something also to think about to build a conflict resilient culture. طيب خلاص يعني I think إنه نحن كده kind of I wrapped everything up. What is the whole thing? What are the implications? نحن we need emotional intelligence. We need to integrate the emotional intelligence with conflict intelligence training with the all dimensions. الحين نحن we talked about the experience of conflict from كلها three aspects. في cognitive part the perception, there's the emotional part والbehavior part اللي هو that entail the whole conflict experience. Conflict has these three aspects that we need هنا to create training for this. And it's not just at the level of individuals, it becomes لازم كمان at the level of team. We need to create collective kind of emotional literacy of the healthcare team. Psychological safety. أنا قاعد أعيد نفسي كثير في الموضوع هذا because I know how important it is. Curriculum integration. It's in medical schools or otherwise. Human skills, and I call it human skills. Conflict management is part of these human skills. If they should be implemented long term, not just a stand-alone workshop وانتهى الموضوع. لا, long term curriculum implemented with the curriculum of the healthcare or the health profession يعني. Experiential learning كمان هذا مهم طبعا. The role playing, the simulations, and these human skills, they can do wonder. لأنه even with simulations that people go, they know that they're going to role play. They're going, oh, this is just a simulation. These simulations still provoke emotions. So that's why simulation actually it's like a wonder for in healthcare education, the simulation. That it creates the whole emotional experience, it is recreated in the simulation. So you learn from this. And the whole learning process is a lot of it is emotion. Organizational change, as I said before. So you combine both the skills, the individual skills development and the systemic restructure. صح التعبير. And research, there are always very open, the floor is open for research. Whatever I just said for the applications, they are all research projects that can be implemented. And we follow up with. Takeaways, I would say conflict is inevitable, but destruction is optional. Understanding your triggers and the steps of engaging constructively with conflict, at least when you think about your own self. And I'll give another one. And there is always an interplay between cognitive, emotional, and behavioral aspects of the whole conflict experience and the misalignment process. think هذا كمان هذا اسمه we talked about that emotions are always central to the conflict experience. They are not preferred to the conflict. يعني الانفستمنت في الايموشن part is important عشان to engage in conflict constructively. الprofessional identity, as I said, that is always with conflict, they're always challenged and reconstructed with every episode of conflict. Imagine yourself when you worked as a healthcare provider for 20 years or 30 years, and you're just reinforcing an identity. You don't like that identity because it ruined kind of your professional life with everyone else. مشكلة. Leadership is about managing the environment that creates the conflict, not just the people. So that's why when I say top down, bottom up approach for leaders. Remember the case? Now here I wanted to see yourself as leaders rather than just Dr. Amin or Dana. You are the leaders, and what are you going to do with this? This is the final reflection before we close off. 2 minutes ونصلي على النبي. All right, thank you everyone, and I really appreciate your time and listening to me babble a lot about conflict. And I hope that this is going to be to spark a future discussion about this important topic in our field. The quality of your professional relationship determines the quality of your professional life. Thank you.
Thank you very much, Dr. Wright. We really enjoyed the session, and yeah, I wish there's more time to learn about this very important and yet interested topic. I would like to open the floor for the candidates if they have any questions to Dr. Wright.
I'm happy.
Dr. Taysir, go ahead, please.
السلام عليكم ورحمة الله وبركاته. شكرا جزيلا دكتور هشام، وشكرا دكتور رايد والزملاء الأكارم. تيسير كاشف فاسيليتيتر از اي دي سي. صراحة دكتور رايد يعني شكرا على السرد الجميل الممتع والمحاضرة الوافية الضافية زي ما بيقولوا. خلال حديثك صراحة أول ما وصلت للسلايد بتاعت الكونسيكونسز اوف كونفليكت وبرضه الدايناميك كونفليكت موديل، طوالي في important point صراحة هي popped up into my mind. لكن يعني thank you, you covered it thoroughly throughout your interesting talk. اللي هو البوينت بتاعت إنه this conflict يعني is a part of life، ولا مفر منه. يعني مهما تمشي ومحل ما تقبل حيقابلك الكونفليكت. وطبعا واحدة من الليدرز كاركترستكس إنه to taking risk، و this conflict is part of this risk. ف this is good opportunity تخلينا نفكر إنه ننظر ل this conflict as خلينا نقول منحة أكثر من إنها تكون محنة. القصة بتاعت إنه to reform الكونفليكت يعني from a threat to a source of improvement دي حاجة مهمة جدا، لأنه يعني من خلال إنه نعمل شيفتنج للفوكس من انه تكون جاست يعني interpersonal friction to systematic improvement زي ما انت ذكرت اكثر من مره. ودي فرصه برضو انها بتبدا تopen الكوميونيكيشن، وبقول لك دائما انت خليك جزء من الحل، ما تبقى جزء من المشكلة. أنا بخليه إنه if we treat this conflict and manage it properly، عنده فوائد كثيرة جدا. من ضمنها يعني الأشياء أنت ذكرتها قد تكون إنه ممكن تعمل يعني to pop up some underlying concerns، مش كده that might otherwise يعني ممكن تكون remain hidden. وأنا أفتكر دي مهمة جدا بالذات في القصة بتاعت الحتة بتاعت الهاي ستيكس environments. بالإضافة للوقع بتاعك من ناحية بتاعت communication، يعني هي encouraging and speaking up. وطبعا دي بتأثر مباشرة في نقطة مهمة برضو ذكرتها دكتور رائد، اللي هي psychological and cultural safety. وما ننسى القصة بتاعت اللي يعني إنه through reforming this conflict نحن encouraging the use of structure، خلينا نقول communication tools or pathways. الناس يعني يكون عندها active listening و perspective talking، crucial conversations، وبالتالي بتدينا مساحة خليه to navigate. برضو خلينا نقول الباور ديفرنسز بين الباور ديفرنسز والباور داينامكس. برضو القصة بتاعت اللي انت يعني شيد لايت اون ات، هي القصة بتاعت التيم كولابوريشن، سواء كانت بصورة مباشرة أو بصورة غير مباشرة. يعني أنت ذكرت غالبا في نهاية المحاضرة إنه شيء ممكن يكون من الفوائد إنه بعض الكونفليكت ممكن ينتج من حاجة مهمة جدا، اللي هي الرولز. ما بكون كل الناس أو الستاف الشغالين في المؤسسة عارفين الرولز، أو بيكون في تداخل. فبالتالي through clarifying these professional roles يعني آه، في بعض الرولز بتكون يعني ambiguous كده، وبيكون فيها overlapping. فبالتالي reforming these disagreements هو allow the team to use the conflict as a tool to clarify a role. فبالتالي دي برضو منحة ممكن opportunity ممكن نستعملها. آم، طبعا الشباب عارفين انه في مثلا في عندنا كونسبت زي الستورمينج فيز مثلا في التيم ديفلوبمنت. ده teaching يعني teaches the learner انه that conflict is a natural part of the team growth. بالتالي يعني this perspective helps team to preserve professional relationships while resolving disagreements. الحاجة اللي أنا داير أقولها إنه يعني what I want to press on is when we reform a conflict, we provide clear reporting pathways and leadership expectations. فبالتالي احنا ensuring انه ذات disagreement بيؤدي ل systematic level learning and better team functioning. شكرا جزيلا دكتور رايد، شكرا جزيلا دكتور هشام، يعطيكم العافية.
يعطيك العافية دكتور زكي. صراحة يعني everything that you said صراحة is like gold mine. You summarize everything I said, and it's important to take note that again conflict is always going to be there. يعني نحن we don't have a say. يعني it is حتى كمان more difficult لأنه نحن we're leaders. not نحن خلاص يعني بنروح we're gonna give the patient care وحنروح البيت خلاص. يعني leaders عندهم responsibility كثيرة. layers حتى نحن even the subordinates يعني ما they don't see it. They see sometimes super leaders هذا is مثلا abusive ولا controlling كده. بس في شغلات كثيرة that going behind the scene that if we don't know the layers of leadership ما اسمه تكون غائبة يعني. وكان I want to refer back to دكتورة رشا ثالث سؤال مهم. And as a subordinate, how do you think you should engage with controlling leader who abuses his power? انا the way I see conflict probably this is نحن اللي تكلمنا عنها. conflict لما يكون في عندنا disagreement، يكون في misalignment من our goals ولا values ولا priorities وكلها. يعني هذا الكونفليكت. الكنترولينج abusive leaders they abuse their power. I don't think نحن we are in a conflict anymore. This is bullying صح. صارت انا approach ما عاد صار conflict. حتى the whole approach اللي انا ممكن اكون تكلمت عليه ممكن ما ينفع. It might not work اساسا يعني لانه هذا someone is actually الحين يعني using his power bullying people. فهذا ممكن ندخل فيه discussion مره مختلف الحين. لان انا at least personally I don't see this as a conflict anymore يعني. هذا bullying، وبولينج فيه probably layers فيه مثلا you can complain مثلا to someone who is above that اسمه direct leader. ممكن يكون احيانا يكون في شكوى، ممكن يكون في عباره عن قضاء وكذا، في شغلات كثيره يعني to take عشان حد ياخذ مثلا حقه او حقك منه يعني. بس يعني I don't see this as a conflict صراحة يعني. فأنا probably أحتاج more details about إيش التصور about the controlling وال abusing leaders عشان أقدر أعطي جواب شافي.
Thank you very much, Dr. Raid. Indeed, وأعتقد uh, the bylaws, institutional bylaws, policies, and procedures will add to that point. Shifting from conflict to um, bullying or even, um, actively abusing the authority
Mhm.
to
Right.
stuff. Yeah,
Right. Yeah.
yeah. I have one question myself.
Go
I
ahead.
I mean, I can't stop thanking you for shedding the light in very important aspects in this topic, and I do believe it strongly on institutionalizing the institutionalization of things, and whenever I have the opportunity, at least to bring that up to the level of discussion at least and take it to the next level of planning for it to be part of an institution policy or even education that would be a sustainable benefit, of course. Now, my question is, يعني, as you said, موضوع الconflict is inevitable. That's part of our life. It's an experience. Now, um, we all come from different backgrounds and institutions as we are now. And based on that reality, now, conflict is inevitable. What's your advice for us as a system, as a health professional education system, to, I would say, um, introducing a culture of conflict management or conflict nature acceptance to our institution? As you say, people mostly feels uncomfortable, you know, even talking about a conflict, and they might prefer to, take a path or another to avoid managing the conflict or even being part of it. So, just few recommendations from your experience how we can, create this culture of accepting the conflict and managing the conflict as part of our institutions, of our different institutions. Thank you.
طبعا هو it's always going to be part of the on the leaders shoulder صراحة يعني. لأن هم leaders they have a lot يعني عندهم decision making يعني. they can enforce this يعني ما حقول enforce يعني they can create this يعني. but let's assume إنه ما في عندنا leaders هذول. أنا would say something that زي الجماعة الطيبين اللي موجودين عندنا هنا 28 واحد قديش مثلا. أنتم الحين you have some knowledge. you're reading over some concepts of الكونفليكت وأهميته إنه وجوده وغير وجوده وإنه دائما is going to be there يعني. أنا the way I see it كأني أنا حطيت عليكم حمل. فتنس حمل عليكم الحين أنتم لأنه because you are now knowledgeable about this it's going to be your burden now to carry. Now هل هو حيكون سهل؟ لا ما حيكون سهل. can we change the institution at the يعني very high the highest leadership؟ يمكن لا في البداية at least يعني. That's why يعني we can start small. يعني نحن مثلا انصح I said top down و bottom up. top down وسط جزء. head of department هسه هذا جزء بس صغير من المنظومة. head of department اشتغل على اللي معاك. with the people that have you have كم عندك 50 مثلا 100 اشتغل عليهم. هذا you start developing the skills of each one of them in longitudinal program. Now I don't think انه اللي هو ال 4 hour workshop ولا 2 days workshop هتنفع دائما. هي حلوه attending هذا، بس بالاخير people they go always go to their old habit.
مم.
But something that is in longitudinal هذا يعني مهم. and انت هذا الحين at the level of the اللي هو individual. الحين at the level of leaders you as مثلا اللي هو head of department tab you start creating this اللي هو الاتموسفير، خلينا نقول السمول ايكو سيستم. هذا يعني انه ما اذا في كونفليكت كذا you start talking. خلي الناس تتكلم عن الموضوع. ترى نحن we're having lots of conflict. I wanted to speak up. اسمع،
مم.
ما you don't want to speak up to colleagues، تعال عندي فضفض. عشان تمسي اسمه ايش اللي صار يعني. I'll see what I can do about it because now let's say you're the leader. شوي شوي الناس واحد يعني من ال 50 let's say اللي موجودين يعني يجي لك اثنين بس they start talking about it. بس يعني هذول الاثنين you can يعني start relying on them ان هم they started to spread the word.
مم.
شوي شويه the system يبدا يتغير من عندك هذا المؤسسه الصغيره اللي هو الديبارتمنت حقك بس يعني. الاثنين
مم.
حيصيروا اربعه، الاربعه حيصيروا ثمانيه، ثمانيه حيصيروا 13 شوي شوي يعني. دحين لما الاذر ديبارتمنتس يشوفوا انه انتم عندكم انفايرمنت غريب قاعد يصير. لا no one is seeing، ما في شيء جديد علينا يعني. no one is seeing this يعني.
مم.
people start to start calling you انت ايش قاعد تسوي؟ what are you doing يعني. people كثير let's say مثلا نيرس في ديبارتمنت اوف سيرجري قاعد تقول انا ابغى اروح للديبارتمنت حقت الميديسن.
مم.
في شيء هناك يعني مبسوطين الناس قاعدين يعني يتكلموا عادي، ويتكلموا الكونفليكت كانه شيء عادي يعني.
مم.
this is how هذا يعني شوي شوي I think probably it's going to be يعني اللي هو up حبه 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 يعني. طبعا هذا it's very ambitious. it's a very
Yeah.
ambitious vision يعني هذا. لكن ليش ما نتفائل يعني. think about it this way. The system is created اسمه by people from people. فالسيستم هو ناس اصلا they are people the system.
Yeah.
فستارتنج مع الناس هذول الناس اللي هم يبغون اصلا يحسنوا المكان. وستارت تارجتنج ديس اللي تحس انه عنده فيجن يبغى يجرب يبغى يسوي، بس يقول بس فاقد الامل.
مم.
طيب جرب هذا، جرب بس اللي عندك الناس اللي هم الخمسه سته عندك جرب معاهم. خليهم هم يبغوا يتكلموا، خليهم هم يعني. وزي هذا زي الماركتنج، عرفت زي الورد اوف ماوث كانك تسوي ماركتنج للموضوع.
Yeah. Yeah.
كان افتكر يعني هذا كذا at the top of my mind الحين when you ask me يعني.
Thank you very much. Very helpful indeed. And yes, for sure that will definitely, trigger a culture of conflict management. I would like to call Professor Saad if you have a question, please.
Yes, thank you, Dr. Hisham. From the scenario of Dalia and Dr. Amin, my question is how shared leadership can be adapted to local cultural norms that traditionally value seniority and top-down decision making?
سؤال جيد. and I don't it's a very good question and I don't have a very good answer. shared leadership. طيب معلش انا بسألك السؤال هذا. what do you mean by اسمه define shared leadership؟ عشان ابغى اعرف انت what is your definition of shared leadership.
Shared leadership, they share their values, their decision making, they share في كل الحاجات بيشاركوا بعض.
يشاركون their teammates ولا their other leader؟
يشاركون الليدر يعني
other leader.
الليدر ما يشيل كل حاجة، يعني الناس تشارك في القرارات في كل شيء. تفهم الليدر الشيرد ليدرشيب.
شوف انا ما حدعي اني عندي خلفيه كبيره هذا، لان الموضوع هذا كبير وانا قرات عنه very minimally. ف I don't know how انا صراحه to be honest صراحه انا I don't know how usually leaders يتكلموا مع بعض يعني. انا يعني عندي الناس اللي انا تكلمت معاهم يعني حبه حبتين يعني في leadership positions يعني easy to influence يعني. لما نتكلم على leaders على position عالي يعني انه how they shared يعني I think انه يعني اللي هي leadership training probably لما نحن نسوي training leadership should be يمكن different than training for the teammates. يعني يكون في training زي مثلا emotional intelligence مثلا يعني، او حتى يمكن زي shared leadership هذا الحال له training اذا انا ماني غلطان يعني. هذول لازم يكونوا مع بعض وهم لازم عشان لانه هم يعرفون هم في البوزيشن هذا اللي ياخذ فيه قرارات يعني خلينا نقول ياخذ فيه قرارات يعني. فهم هذول دي نيد اول شيء زي ما تقول يتدربوا مع بعض، وبعدين سي انه هاو كان اوكي انا اقول الحين انا عندي مثلا افكار وانت عندك افكار كذا ليدرز، انا ابغى الديبارتمنت حقي الحين خلينا نجرب انا وانت نفس الفكره مع بعض on our department whatever نحن we came up with يعني، و start discussing ايش الاوتكمز حقتنا، انا ايش صار عندي وايش صار عندك يعني. وهنا probably شوي شوي فكره الاذر ليدرز اللي هم ما قاعدين يطبقوا اللي انتم قاعدين تطبقونه يعني، the start برضه اسمه to communicate انتم what are you doing with your team يعني مثلا يعني هذا مؤسسه فيها مثلا 50 ليدر 50 ديبارتمنت وات ايفر يعني، قاعدين ثلاثه قاعدين فيه يسوون حركات غريبه يعني ما عارفين ايش هي يعني. start people start other leaders will start to communicate يعني. انا I think كمان واحده من الشغلات المهمه انه التريجرنج البين بوينت حقت الليدر.
مم.
يعني الليدرز عاده يكون في عندهم بين بوينت مو هم عارفين كيف يتعاملوا معاه، يمكن مو الكونفليكت يمكن مو برايورتي، بس في عندهم بين بوينت. هذا ستارت تريننج في البين بوينت هذه، لانه اتس جوينج تو بي بارت اوف ذا اكسبيرينشال ليرنينج. يقول اوكي انا هذه عندي مشكله الحين ابغى حلها، ابغى الحين احلها شوي شوي. وات يو gonna to notice انه في other three leaders عندهم نفس البين بوينت هذه، لان البين عاده يعني نحن تقريبا متشابهين از هيومنز يعني، عندهم نفس البين بوينت هذه. شويه شويه تلاقيهم انه هذول اللي هم فعلا محتاجين هم اللي انت يو امبلمنت هذا بس يعني معاهم يعني. انا اول ساعات بالذات انا من اول قاعد اقول لونجيتودينال بروجرام وكوريكولوم زي كذا يعني، بس
Yeah.
ليدرز لانهم دائما مشغولين واحيانا يكون ما عندهم وقت يعني. need to be smart how to design something، تعرف انه يعني يطلع من هنا يروح يطبقه اسمه الساعه اللي بعدها يعني.
Yeah.
يعني ذات كايند اوف ابروتش في يعني احنا از educator نحن وي ديزاين كوريكولم في الاخير زي كذا يعني. حتى لو جيت لنا كوريكولم يبغون شغله هم مره براكتيكال. احيانا يقول لك انا ما عندي الحين ريفلكشن وزي كذا، مو هذه مشكلتي، في عندي مشكله لازم احلها الحين
مم.
يعني. خليه يطبق هذا شوي شوي لما نشوف الفائده يقول خلي اوكي دحين انا ام gonna جو تو دكتور ساعده ولا هذا يعني ساعدتني في الموضوع هذا، خليني في عندي مشاكل ثانيه خلينا قاعد نتكلم دحين فيها معاه. يبدا الموضوع ينتشر، هذا الموضوع بين خلينا نحن نتكلم عن الليدرز بين الليدرز يعني. انا
واعتقد
عارف ان انا يمكن خبصت كثير في الكلام يعني، بس اي هوب انه يعني I had something من اللي من اسئلتك.
thank you very
سوري
much.
اوكي.
ولعل اضيف انه اعتقد من بعض مسؤوليات القياديه to look also 360. So عندنا دور
مم.
تجاه القيادات في نفس المستوى المؤسسي والمرؤوسين في نفس الوقت. ده مبدأ مهم انه نعزز لمفاهيم الشيرد values و addressing the issues or the conflicts or the misbehavior with conflict as part of our daily life. I would like to call Dr. Taysir, please.
شكرا جزيلا دكتور هشام. شكرا دكتور رائد من جديد. لعله انت يا دكتور هشام بديت جزء من الحاجه اللي انا داير اقولها. بالنسبه لل يعني القصه بتاعت الشيرد ليدرشيب دي، انا كنت عايز اقول حاجه انه القصه دي هي بتجي بالاويرنس ريزنج اويرنس زي ما قال دكتور رائد. لانه في الحكايه كلها مربوطه مع بعض، نخليها بحلقه. يعني نحن الان لو دايرين نتكلم عن الليدر شيب، بتلقى في ميس كونسيبت بين الناس انه والله الليدر ده هو هيراركيال، زول اكبر منك وزول كده. لكن تخلي حتى في الشرع الاسلامي النبي صلى الله عليه وسلم قال كلكم راع وكلكم مسؤول عن رعيته. مش كده؟ يعني نحن المفروض نوصل لمفهوم الشرير شيء، بمعنى انه زي ما انا عندي مسؤوليات انت كمان عندك مسؤوليات. الحاجات اللي انا بعملها لو ما انت عملت دورك برضو انت ما بتقدر، او القصه دي ما بتبقى. يعني مثلا انا ليدر خطيت استراتيجي معينه او خطيت بلان وانسباير يو كده، بدون ما انت تنفذ الحاجات اللي عليك ودون ما تقتنع انك انت برضو ليدر في مجالك كويس، ما حتقدر. عفوا اذا في باك جراوند نويز، فما حتقدر انك او المشروع ده او الاستراتيجي ما حتطبق. مش كده؟ وعندكم واحد من انواع الليدرشيب، شوفوا لانه يمكن يجيكم في الامتحان، يعني مش كده؟ ليدر هو انسبايرد الاورجنايزيشن لكن فيلد انه to save or preserve الكونستراكشن بتاعت الاورجنايزيشن، لانه هم بعد كده كولابس بعد ما هو مشى او كده. الشيء المختصر انا داير اقوله انه نحن المفروض نوصل لمفهوم انه كل واحد هو ليدر في مجاله. الليدرشيب دي هي ليست حاجه هيراركيال ولا زي، يعني انا اذا بقيت قلت لك انا المدير بتاع الشركه معناتها خليني فاهمين انا الليدر بتاعك، ما معناتها انا مثلا هيراركيال اعلى منك، لا، انت بتعمل حاجات انا ما بقدر اعملها، لكن انا بشوف حاجات مثلا انت ما بتشوفها، وانت بتشوف حاجات انا ما بشوفها. فاذا كل واحد اقتنع انه هو الليدر في مجاله وبيقدر، يعني ما في زول بيقدر يعمل الشغل اللي هو مخول انه يعمله بنفس الجوده والكفاءه، ورفعنا الوعي زي ده، يخلي ما بكون في اي كونفليكت بعد كده، وكل واحد بيكون ليدر، فبالتالي يكون في شير ليدرشيب، ويبقى عن طريق بعد كده مربوطه بالكوميونيكيشن وبالحكايه دي الامور تلاقي بتمشي. شكرا جزيلا دكتور هشام، دكتور رائد، جزاكم الله خير.
يعطيك العافيه دكتور. طبعا هو دائما مشكله الموضوع هذا انه الهايراركي كذا، يعني انه الليدرز يعني بنشوفوا نفسهم على انهم احسن من غيرهم، انهم هم at the top of the hierarchy هذا يعني. انا اتوقع صراحه اتليست هذا from my readings، يعني انه اللي يوصل للمرحله هذه من الليدرشيب وما زال عنده insecurities about انه والله واحد حياخذ منه البوزيشن ولا واحد شاطر وكذا، يعني هذا التعامل معه صعب. لان هو يعني انت لازم تتعامل مع الانسكيورتيز حقه اصلا دحين. مشكله ما يكون انسكيور وهو ليدر، خلينا نقول هو شاطر ومتمكن بس انه خايف. هذا ترى مو سهل التعامل معه، يعني هذا ما حقول انه لازم يروح ثيرابي وكذا. خلينا نقول نحن از تيم كيف نقدر يعني خلينا نقول نعزز الثقه اللي فيه، انه ترى نحن صح، نحن تيم وانت الليدر حقتنا. ممكن يتعزز بارت اوف انه عشان هو تو شير الاكسبيرينس حقه والخبره معاكم وثقته فيكم، يعني انه ترى نحن اسمه من دونك ما نقدر ترى نسوي الشغل. ترى انت الديسيجن ميكر، انت يعني لازم تكون معانا، نحن وان تيم. خليها يعني هو الليدر لما يكون كذا يقول نحن وان تيم وفعلا يعنيها، هذا لك يعني رهيب. لكن اسمه لما اللي ما يقول هذا الكلام، خلي التيم هو اللي يقول انه ترى انت اور ليدر، ترى ونحن يعني نثق بكلمتك. اعطينا ونحن اسمه واللي انت تبغاه بنسوي لك اياه. شوي شوي تزيد الثقه، يبدا حتى هو يحب التيم حقه ويبدا تشير الاكسبيرينس مع اسمه هيز اكسبيرينس مثلا والسكيلز معاه. هذا عشان تتاب انتو الانسكيورتي حقته وتحاول انه قد ما تقدروا تو مينيمايز. نحن ويل نيفر بروبلي نو anyone's in our team الانسكيورتيز حقته يعني. هذا الا لو كان تيم مره خرافي واحسن تيم في العالم يعني، بس صعب انه هذا كذا يعني. بس إن من البيهيفيرز اللي تطلع من هنا ومن هنا يعني. واحيانا صراحه ترى الكلمه الطيبه ترى تسوي فرق. يعني انا think it goes a very long way. لما انت تخيل لما تقول لواحد انه ترى يعني سوى شيء كويس وتقول له ترى انا شفت اللي انت سويته، واي صراحه I really respect it. It made a difference. حتى لو انت ما تشوف الديفرنس هذا، ترى it makes a difference. وانا I saw this in me والother team members. وروح اذا تبغى تتاكد روح اسال يعني. هذه ترى الكلمه الحالة، ترى حتى اللي يكون عنده ايجو مره ضارب بتلاقيه شويه كذا انبسط على خير يعني. بس يعني كذا ده توب اوف ماي مايند الحين ردا على دكتور تيسير يعني.
العفو دكتور رائد. احنا عندنا في السودان بعد اذن دكتور هشام بيقول لك يعني الكلمة الطيبة صدقة، مش كده؟ وعندنا اهلنا بيقول لك
صحيح.
الكلمة الطيبة معطت شنب الاسد. يعني هو مشى معط شنب الاسد بالكلمة الطيبة، انت يا الاسد وانت بتاع فعندها اثر السحر صراحة يعني.
Yes, yes.
صح، اثر السحر يعني. لانه بعدين لما يسمع الكلام هذا ويبدا يثق بالتيم يعني، تصير يو كان بعدين مثلا الشغلات اللي فيها شورت كامينج تقدر تقول له انه ترى في شغله زي كذا، يعني انه مثلا قاعده تاثر على التيم مثلا سلبيا زي كذا، ما حيقعد يصدق على طول. لا خلينا نقول انت عايش تعبش عبيت رصيد عنده انك انت مدحته. وخلينا سبيشالي انك لو انت يو اكشلي منتد، يعني مو انك يعني قلتها بس عشان تكسب، لكن اكشلي منتد انه فعلا هو اللي سواه عمل فرق يعني. وتقول لي اياها كده يعني على وجهك يبين انك واثق فيه. ترى بعدين يصير لما تجي تعطي له فيدباك ما يرتاح، مو مرتاح له هو، ما حيصدق على طول، حيفكر في الموضوع.
صحيح صحيح. الحديث ذو
يطول
شجون،
صح.
ولعله يعني I quote one of the wonderful statements you addressed today. It's me and you against the problem. It's not me
Yeah.
against you. فأشكرك على كل دقيقة في هذا اللقاء دكتور رائد، والشكر ممتد صالة أن نفسي وجميع الزملاء والإي دي سي نشكرك مرة تانية، ونحن نطمح ونطمع في لقاء إن شاء الله آخر مع حضرتك إن شاء الله في مقبل الأوقات بإذن الله تعالى. أخذنا من وقتك الكثير.
لا
More
بالعكس،
than
انا حاضر
expected.
جدا لاي احد يعني يحب يتواصل، ويعني واكستند الدسكشن. الايميل كان موجود في السلايدات ان شاء الله، يو كوتد if you want me to send the slides كمان فيه، ما عندي مشكله يعني. بالعكس انا يشرفني صراحه اي احد يتواصل معي عشان try to brainstorm some solutions على الوضع المأساوي حقت الهيلث كير اللي عندنا يعني. بنحاول احنا we're all يعني في الاخير I want every one of you يعني، سواء انت تشوف نفسك ليدرز ماسك بوزيشن ولا لا. ترى نحن طالما انه في الهيلث كير ترى نحن ولي بس. نحن ترى يعني الناس تشوفنا ترى شيء كبير. ف don't sell yourself short. you're actually worth it. وعندك experience وعندك يعني خلينا نقول قلب انك تساعد. that's why نحن why we're here يعني. don't sell yourself short. you are a leader يعني. I would say it this way. you are a leader whether you like it or not. بالسنس انت you're in a healthcare.
Yes, indeed.
Yeah.
ولعله ناخذ وصية الدكتور رائد الآن على عاتقنا، حمل رسالة ووصية لنا بمختلف مرجعياتنا وأعمالنا ومؤسساتنا. And we take this further to our institution and work on introducing a culture of conflict management and resolution. Thank you very much, everyone.